Greetings to everybody at the Nova Institute annual conference. I'm so sorry not to be able to be there with you in person. I will be in Singapore on the other side of the world when this conference is taking place. So I'm glad to be able to report a message, but very sorry not to be with you in community. My name is Sam Myers. I'm the director of Planetary Health Alliance, and Susan asked me to talk to you a little bit about the field of planetary health and how it sort of relates to the NOVA community, I think. Planetary health really emerges at a unique moment in human history. The same truly extraordinary advances in science and technology that have significantly improved most metrics of human development over the last 60 or 70 years have also been driving this really extraordinary ballooning of humanity's total sort of collective ecological footprint. The core concept of planetary health is that the scale of our collective activities now really exceeds our planet's capacities to absorb our wastes or to produce the resources that we're using sustainably. And as a result, our activities are transforming not only the climate system, but also driving the sixth mass extinction of life on Earth and changing biological diversity, changing land use and land cover, altering biogeochemical cycles, driving scarcity of resources like fresh water and arable land, creating pollution at a global scale of air, water, and soil, so that the way we're living is collectively transforming all of our planet's natural systems. And those transformations are interacting with each other in very complex ways that we're just starting to understand, but that affect the foundational qualities that underpin human health and well-being, the quality of air we breathe, the quality and quantity of food that we can produce, our exposure to infectious diseases and extreme weather events, even the habitability of some of the places that we live. And as a result, we are seeing really accelerating impacts across every dimension of human health, from nutritional outcomes to infectious disease exposures to non-communicable diseases to mental health effects to population displacement and conflict. And so we're seeing that our own transformation of nature is now driving what's likely to be the majority of the global burden of disease over the next century. As such, across the field and the movement of planetary health, we are a community forged in urgency, and we're carrying a really critical message that the Earth crisis that we're experiencing is now driving a global humanitarian and social justice crisis. We can no longer safeguard human health and well-being into the future so long as our natural life support systems are fundamentally crumbling under the weight of our collective ecological footprint. And so we need to find a way to catalyze what we call the Great Transition, a rapid, deep structural shift in how we are living on Earth to reduce that ecological footprint, which requires changes across all of our sort of fundamental systems, the food system, the energy system, how we design and live in our cities, circular economy and manufacturing, in order to reduce our footprint and find a way of living on Earth that allows us to protect and actually regenerate the natural life support systems that we depend on. More recently, I've been thinking a lot about how underneath the Earth crisis and the global health crisis that the Earth crisis is now precipitating, there may also be a spiritual crisis, a rupture in our relationship to the natural world. And I wanted to take the opportunity to share with you an excerpt from an essay we recently published as part of the Constellation Project, which is a collaboration that I've developed with Terry Tempest Williams. And this is an essay I wrote in the first small book that we published as part of the Constellation Project. And I'm just going to read you a piece of that essay. The moment that we face calls for more than rapid innovation in our technologies and practices. Underneath the ecological crisis we have created and the global health crisis that it is precipitating is a spiritual crisis. We have allowed our myth of human exceptionalism to create a rupture between humanity and the natural world we depend on. The reverence and awe that most of us feel toward nature have lost their authority in guiding our decisions. We will need to weave a new fabric with threads from indigenous knowledges, the world's faith traditions, literature, and the arts that reasserts our spiritual connection to the natural world. Our story of human exceptionalism, of extraction, domination, scarcity, and ultimately extinction will need to give way to new stories and values of interdependence, equity, abundance, regeneration, and renaissance. Let us seek out these stories, share them with each other, offer their light up into the night sky to form new constellations out of which we can make meaning and answer the only question that matters. How shall we live? We find ourselves actors in one of history's greatest dramas, a lone species with an outsized talent for bending the natural world toward our will, spinning through space on a stunning but fragile planet. The same complex brain that has subjugated much of nature toward our desires is bringing us news that the state of natural systems and the well-being of humanity cannot remain disconnected. People around the world are suffering. The wild, miraculous tapestry of life is coming unwoven. We are walking a charred path toward extinction. 1,000,000 years of biological evolution and thousands of years of social evolution have brought us to this. Can we change? As we awaken to this moment, can we rise to its requirements? Can we find the humility, the compassion, and the courage to acknowledge the need for a different path and collectively embrace it? 100 years from now, looking back on this moment, could this be our story? Once upon a time, on a stunningly beautiful planet, a very young species with a very large brain woke up to find itself imperiled by its own narrow self-definition and short-sightedness. And with eyes opened, it charted a new course in which selfishness gave way to collectivism, domination and extraction gave way to regeneration, and extinction gave way to renaissance. The story of now remains unwritten. How shall we write it? Thank you so much. And again, I wish I could be there with you in person. Thank you for all you do. And I look forward to interacting with your community in the future.